40 medical students from Romania, Bulgaria, Serbia and Macedonia, who have been awarded the RHSP scholarship, came to Skopje to share their looking ahead towards serving their communities and the broader societies through their newly acquired professional skills in medicine and healthcare. Nowadays, higher education is not a benefit for everyone and it must be considered a privilege, said the director of the Roma Education Fund, RHSP, during the 3rd Regional Students' Conference 2017 of the Roma Health Scholarship Program. Globalization, that started in late 90s, helped the Romani agenda. The speed of information and learning contributed that we connect much better and learn from each other.
We are not quite sure what kind of jobs will be required at the labor market in the next 10 years. Because now you are currently studying theoretically and later trying to apply your skills in the reality about the current needs of your vocation, but then in 10 years' time you will probably need to continue with your learning and also advance your skills and expertise.
What motivated you to study medicine?
The basic motivation for me to study general medicine was to integrate Roma children, to participate in those disciplines and to educate them that they should be more independent in their choices, that they should be the change they want to see in the world, and to see the progress, and when I will become retired, to see my past as a very successful and very confident and full of happiness, and with the thought that I was the reason and participated to the change of the next generation.
Who or what contributed the most for your decision to study and embark on your career? Do you have any role models?
Well, actually, I didn't have a role model like a person. It's that when I was little, everybody in my family and everybody around me were excited about when we were going to the doctor. Oh, we're going to the doctor. Oh, we need to go to the doctor said this, the doctor said that. Everybody, and I always wanted to know what's that everybody, the doctor makes everyone excited. What's the thing that when someone says a doctor, it's like really special. So that's why I wanted to also pursue medicine. And my family knew that I would go because I was studying medicine also in high school. And I think that I would have gone in that direction because it was the most comfortable for me, because it's a human profession and you can really do it if you want to help someone.
How do you see your medical activities in supporting Romani communities in your native town of Prilep?
Како и во секоја ромска заедница, често пати сум била сведок на ситуации каде
As a person living in a Roma community, unfortunately, I witness very frequently discrimination against the Roma people due to their skin color and identity. This is the chief incentive for me to decide to study medicine. I would like to be a medical doctor in a Roma community. I think that when a Roma doctor works with Roma patients, the cooperation is more effective than if a non-Roma doctor establishes a contact with Roma patients. In such cases, an obstacle appears which impedes the proper communication with people. Due to lower education level of most of the Roma patients, they receive irrelevant health protection, irrelevant access to medical treatment, in contrast to other nationalities within the country. What is your advice for young Roma who want to pursue their studies in medicine? They always have to be hardworking in order to fulfill their dreams. This is what I've been doing since my first year in medical studies. Also, thanks to the Roma Health Scholarship of REF, we have better motivation to accomplish our goals and dreams. Thanks to the stipend, I was able to buy all necessary textbooks, books, and to cover my travel expenses from my native town of Kumanovo to Skopje. The stipend was a step closer to my dream to become a cardiologist. How do you see yourself as a professionalist in near future? I see myself as a Roma woman who is a medical doctor and who can help her community. I would like one day to become a general practitioner, also to be able to work with my mother, because she is the first and only nurse in Kumanovo who is of Romani origin.
The reason that I chose medicine is that my sister, which is older, almost 2 years older than me, she also is a medical student, and that also played a big role in me choosing also medical profession.
Are you involved in any sort of voluntary service in your community?
We had some sort of actions in our communities to help youth prepare for their entrance exam and specifically for the medical studies and that kind of things. It was voluntary based, so as a scholarship beneficiary, we didn't receive any additional money. So it was voluntary work and our will to help.
What is the feeling to be part of a team which saves human lives?
I feel that almost every day and it makes me happy. I'm speaking about the need to help people. When a person is healthy and he or she wakes up after anesthetic. I think my vocation is to be a medical doctor because I feel an internal need to help people.
Why did you choose to study medicine?
I liked chemistry very much, and at first I wanted to become a pharmacist, but I thought it's really boring to sell medicines, and I wanted to help people. So I thought that I want to be a doctor, although it's very hard, but I like the adrenaline in my life, and also I want to wear the stethoscope, because it gives me more importance and the people will respect me. Intubation is my favorite, actually. I tried a lot on mannequins. I didn't try on a person so far, but I watched because I did a practice on anesthesiology, and this is what I like. And emergency medicine, I like giving first aid in case of fractures or accidents or whatever.
How do you see yourself as a professionalist in near future?
So in my village, actually I don't think nobody went to medical university for about, let's say, more than 20-30 years. We have a local hospital, and I think there are no more than 5 or 7 doctors there, and they're kind of waiting for me to finish and go there and treat the local people.
Do Roma doctors have to serve mainly their Roma communities?
It would be wrong for Roma professionals to just practice to only practice in Roma communities. I think I think this would just move forward. It would perpetuate a system of segregation, a reality that we already face. What we need is, I think, both the Roma they need to serve anyone, and that way through their experience and through the good job that they do, they will change attitudes, hopefully, in the general population. So first confirming their identity, and then just doing their everyday great job for patients in this case.
In the 21st century, the question is not anymore to read, write, and do mathematics, but to learn how to learn, which means that your learning will not stop with your graduation, but you have to continue to do it constantly in your lives.